Hello. I'm preparing to administer an IV push medication. First, I'm going to cleanse my hands with the hand sanitizer. I gather up my supplies. I have my container for the sharp, my normal saline, my alcohol pad, my 3 milliliters syringe, and I got the my needle and the practical ferromycin. And so I'm going to read the MRR, which is Renee Adams, date of birth 5/25/1978. No known allergy. It's ferromycin injection, 10 milligram per ml, 20 milligram IV push every 12 hours, PRN for weight gain greater than 3 pounds to be administered over 2 minutes with 3 mLs normal saline flush and after. So now I'm going to prepare my furomycin. First, I'm going to take the cap off. And then I'm going to rub with the alcohol, cleanse the area. And then I'm going to get my syringe. Got it open already. And my needle. Only want 2 mLs in there because it's 1 ml. 1 ml equals 10 milligrams. We want to give 20 milligrams. So I'm going to push and I'm going to hold this up. Let the syringe go back. Up to 2. Perfect. Now I'm going to release any bubbles in here. Release the bubbles. Perfect. Now I'm going to recap it. So furomycin 20 milligrams every 12 hours. 20 milligrams to get 20 milligrams. This is 10 milligrams per ml. So that's 2 mLs on a give. So this is what this is right here. So what I'm going to do, since I rechecked it again, I'm going to label the my medication. So that is done. That's the label. Put it at the side. So that's 20. 10 milligrams. I'm giving 2, so that's 20 milligrams. And it says 20 milligram IV push every 12 hours. I rechecked that again. So they're saying they want me 3 mLs normal saline flush. So I'm going to open up my saline. You only want 3. So that means I'm going to have to waste, it's 10 here. So I'm going to have to waste 7. Place it down without me touching it. I like to keep an eye on this sauce. My goodness, it's kind of hard to push the saline out. Before I go any further, and then I just want to make sure. Okay, 3. I'll put this back on. And then, so that's one saline for the flush. That's done. I like to put everything to the side. Now the other one. So I had checked the MARA several times, make sure it's the right patient, right medication, right dose for the IV push. And also it's going to be the right time. Three. So, here are my 3 mLs, normal saline. Okay, so I'm gonna check the order for the last time before I go into the patient's room. Make sure the Renee Adam, date of birth 5/25/1978, furosemide injection, 10 milligram per ml, 20 mg IV push every 12 hours. So furosemide. So now I'm about to go into the patient room. Hi, Renee Adam. My name is Terry, and I'm going to be giving your furosemide IV push. Before I do that, I would like to check and assess your arm. And first of all, I would like to know what's your name? Good. Let me just check your band. Renee Adams. Good. And your date of birth? 5/25/1978. Awesome. And no known allergy? Great. So I'm assessing everything. I'm assessing just to make sure everything is good. The site looks really good. There's no redness, swelling, and the site is patent. Okay. Now, what I'm going to do, I'm going to scrub the hub. Really good. I'm going to scrub it really good. Okay, after I finish scrubbing the hub, I'm going to do the saline flush. When I do saline flush, I'm also going to pull back to see if any returns. And before I do that, I would like to put my gloves on. And I probably should have put my gloves on when I was doing the scrub. So then I would just redo it with a clean alcohol pad. We'll say this is clean. And then I will just scrub it really hard. Okay, after I scrub, I'm going to flush, pour water, flush 3 mLs. And before I flush, I'm going to do a pull back. So this is locked, but I'm going to unlock it. So I'm going to pull back. I see the return. And now I'm going to flush. Finish flushing. I'm going to get rid of my stuff. And then now I'm going to do the push. So now it's going to be going over in 2 minutes. So I have my second hand ready to go. So my watch has a second hand on it. So it's the few mice and want to draw up. So now put this in. And the site still looks good after the flush. And so I'm going to look at my thing. And so timer is going. And then I'm starting now. It's going over 2 minutes. That's 30 seconds. Okay, it's about a minute, and I have one to go. It's about 2 minutes. I stop, clamp this, and then I'm going to, I'm inspecting the site as I'm doing all this. So then go back. Now I'm going to do my flush. Clamp. Clamp. Okay, dispose my stuff. Checking the site, asking the patient if they're okay, any discomfort. And then you know what, I would have asked them in the beginning, I would have told them, educate them, like if you feel any discomfort, just let me know. So everything is good. Everything is intact, no filtration or anything like that. I finish and the patient has no reaction. Now I'm gonna remove gloves and perform hand hygiene. And then after I finish that, I'm gonna clean up, and then I'm gonna document what I've had done, what I had administered to the patient. And I noticed there was no redness, swelling, or infiltration, and everything was still patent.